Hello. I plan to do a quick eFAST exam. I'm going to explain a little bit, but of course, if you want a detailed explanation, see my full lecture on the topic. I'm going to be using this 3-in-1 Chinese unit, which has a pretty good linear, has an okay curvilinear, and does have a cardiac sector probe function, which is let's start that eFAST exam. With practice, you should be able to do this in less than 5 minutes. Right, and remember, eFAST, we're looking for fluid, because this is a trauma exam. Okay, so we're going to start with lungs, and I'm going to start basically second intercostal space, I'm actually going to turn this on to M mode. I don't necessarily need M mode, I don't think, and I'll change the depth here a little bit deeper. So you want between the ribs, and you have the patient take a breath, and you look for pleural sliding. Sometimes that's hard to see. So you look at the M mode and you look to see if it's more barcode sign or more seashore sign. What will happen is you're looking for basically ants moving across this line. And we see A lines here, which is a reverberation artifact from the reflection with the pleura and the surface. So they're equidistant to this distance. And you see that in pneumothorax and in normal lungs. If the lungs are wet, if there's fluid in the lungs, we get comet tail artifacts, or B lines. And we can get like a giant comet tail artifact would be a confluence B lines. Okay, and next is, we can continue, and we can go down a little bit lower and check again. The other day I was doing this, and could actually see the fissure moving back and forth. You can see the fissure. Neat. So we can check another location. If I have enough gel here. Okay, and we can take our gel and we can go onto the side. We can look there as well. Okay, that's good there. And I would recommend going sort of to the bottom corner. And I'll try to save some gel here. Yeah. So, get between the ribs here. You can see that the lungs come into view. Right there. Let's freeze that. So this is lung, and this was liver. And if there was fluid in the lungs, if at this costophrenic angle, this pleural space here, we would see a hypoechoic or anechoic sort of triangle of fluid here, basically at the bottom of the diaphragm. But we don't see that. We basically see lung straight to liver. So again, we'd see a anechoic, basically triangle here at the surface of the diaphragm if there was an effusion, if there was fluid there, and we don't. This is called curtain sign. And we could also look for B lines here, but we don't. We get A lines. This is normal looking lung. A couple skinny B lines are normal, particularly in the elderly. Okay, so I would repeat that on the other side as well. So now the next view is the subcostal or subxiphoid view of the heart. We're again looking for fluid, pericardial fluid. I have it on the cardiac setting here. You can sort of see the probe orientation. Okay. And so we're looking for hypoechoic fluid here and here, pericardial. I actually don't find, particularly on this setting, since I have the options, the cardiac setting I find is perhaps better at looking at the actual chambers. And in particular, if I'm looking at the long axis view, peristernal view, I find that sector probe view or setting on this quite useful. Since I have all three options here, like you learn your equipment. Learn the instrumentation you have access to. The abdomen setting actually will give me a better picture for looking for fluid, I think. So if I unfreeze that, now the depth is too deep. Let's change the depth here. Too shallow. Right. Like, look at that. I can see all around the heart, and I think I could get a bit. The other one was just too dark, the whole thing. But now I can see all sorts of different types of tissue. And I feel like I could get a much better idea about whether there's fluid around the heart or not with the curvilinear setting. If I freeze this, and I'd be looking for a fluid collection here and up here is where I'd be looking. Now, next, a lot of people, since they're in the area, they rotate the transducer 90 degrees and they look at the inferior vena cava. So this isn't part of the explicit eFAST protocol, but since you're already in the area and you already have the sector probe or the curvilinear probe, and both of those will capture the inferior vena cava quite perfectly, you might as well take a quick look. And there is a reason to look at it in cases of trauma. It does give you some useful information qualitatively, even just with a quick look. So here you can see the transducer orientation here, and I can unfreeze that, and I can get a picture of that. And as I breathe, you should see it sort of compress a little bit. And compressing around 50% with breathing cycles is about normal. In terms of the size, you expect it to be in between about 1.5 to 2.5 centimeters. If it is, let's say, enlarged, and if it doesn't really compress, if it doesn't compress at least about 50%, and it's enlarged and dilated, and when it's dilated, you'll see these lines become more parallel, and sometimes it really doesn't compress at all. That can mean some sort of obstruction, some sort of cardiac pathology. If it is like entirely compressed and it's small and it's very compressed, and if you have trouble finding it, you may look in short axis view, find it, and then rotate the transducer once you have it centered on the transducer. I find that's a useful way of finding structures. You find them in short axis first. When you want a long axis picture, you find them in short axis first and then rotate. In fact, let me do a little example of that. So there it is, and I make sure that's in the center, and then I very carefully rotate, and then it should appear in my long axis. And there we go. Now, of course, as you move around, there we go. There's a perfect picture again. And again, mine compresses just a little bit, which is normal, and it's about the right size. If it's too small, if it is too small, less than that 1.5, or it's completely collapsing all over the place, then that can indicate you don't have enough blood. The person's bleeding out. Bad. So in trauma cases, that's what you're checking. You're checking and you're like, okay, this person's like running out of blood. Like, what's going on? It might be internal bleeding, for example. So now for the perihepatic view. And for the perihepatic view, either curvilinear or sector probe or phased array probe. I use those two terms interchangeably. And if you are using the sector probe, which is the recommended probe, you'd be looking between the ribs. You'll see, for example, here, if I try to put the curvilinear sort of on the ribs, you can see there's so much shadowing from the ribs. Between the 10th to 11th rib is roughly where they recommend you put. And I can see, look, I can see a little bit, so it's not impossible. But I could come, for example, underneath and look upwards, and then I avoid that rib problem. So again, learn your machine, practice, 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 because this is a great view. Look, I can get a good view of the liver and the kidney, and this is the space I'm looking for. This is Murphy's pouch here. So this is a great view, and I would scan through the kidney to see if there's fluid here, and of course you could scan everywhere for fluid. Of course, if you're looking this low, this assumes you've checked the corner of the lung. Because in the eFAST protocol, they're sort of assuming you're checking the corner of the lung, above the diaphragm, and you're checking the Murphy space and, all around the kidney. And you're doing that all from basically the same location. But I already did a lung view, and I already checked the bottom of the lungs with the linear view, so I can just really focus on Murphy's space right now. And I don't necessarily need to check the corner of the lungs because I did that with the linear transducer instead. In which case, for me, as I mentioned, if I'm using curvilinear, I would probably go underneath the lungs so there's no shadowing, and I can just sweep through. If I do switch it to the sector probe, of course, I would be able to see between the lungs. I've mentioned that this 3-in-1, the curvilinear setting is much better than the sector probe setting or option. So the curvilinear is the way to go for me. So I would probably go, again, I have the option, I could go underneath and scan through. Yeah, no fluid around that kidney. And again, I could try to go through the ribs. And you can do it. Again, if I had a sector probe, that's what I would do. And now we're on the perisplenic view. So the other one was perihepatic, right upper quadrant. Now we're in left upper quadrant. And we want to unfreeze it here. And again, oh, those ribs are getting in my way. Again, I can try to sort of go underneath and upwards to try to get a picture of that. And upwards. So there we go. We can look around the kidney to come up higher to get the spleen. We really don't have an option. It's harder to see underneath. Let me try the sector probe setting. Only turns on if you hit cardiac. And I can increase depth here. See, it's quite dark. It's quite dark, but I can still make out around the edges there, right? No fluid there. No fluid there. Again, I'll go back to curvilinear. So even between the ribs, I can still get a good idea if there's fluid around the spleen. And I can move around the transducer to try to see the space between. Again, I'd be looking in this space and make sure that there's no fluid there, and I would screen through. It's hurting my shoulder a little bit trying to do this on myself. Of course, you're doing this on someone else, and you sweep through and screen through basically the entire structure. So lastly, we have the pelvic view, or the suprapubic view. So it's way down above the pubic symphysis, and we're going to look in both planes, and we're just going to be screened through. We're looking for fluid which will be basically around the bladder. So you want whatever settings gives you a good view of the bladder and structures around the bladder. For men, you look for fluid more between the bladder and the rectum. For women, you look for fluid more between the bladder and the uterus. Of course, men aren't going to have a uterus, and you just screen through in both planes. So here, if I find my mouse cursor here, and I unfreeze that, and I'm in, let's say, vertical, and I could screen through. And I don't see a fluid collection. So if I freeze here, just to talk about structures here, right, we have bladder, and then we have rectum here, so I'd be looking around here. Of course, you could find fluid anywhere, but all the fluid, all the anechoic fluid should be inside the bladder. We shouldn't see anechoic fluid around outside the bladder, right? So you're just looking for fluid collections in other locations. And I can rotate this and screen through in the other direction. And I can screen through. And well, you can see the rectum there underneath the bladder, and there's no fluid collection. Okay, that's done. Now, if you prefer, you could do it out in the reverse order than I did, but regardless, just screen through it in both planes, looking for fluid outside of the bladder. And that's it. That's an eFAST exam. So in